All right. Hello, everyone. Welcome. Neurospicy Nursing. If you're new here, hi. If I referred you through my NAC tutoring, well, hello, welcome back. Oops, I didn't mean to do that. Sorry. Welcome back. So nice to see you guys. Today is going to be a little bit different. Obviously, you can hear my voice and not my AI um, over voice or whatever you want to say. Um, because I just thought, for those of you who I tutor, that going through the rationale like this, might be easier, because, when we go through it together, normally I'm a little bit more, can not so, I guess, um, bland about going over the material as the AI voices. I have pitches to my voice and stuff like that. And um, if you know me, a lot of times I try to relate stuff to SpongeBob too, right? So that's just something that might happen today. Um, but for those of you who maybe you got shared this video as just some practice questions, and I didn't give you the full document to begin with because I don't tutor you, and maybe you got it from one of your friends who I do tutor. I have the questions. Obviously, you can see the question up, and I'll give a few seconds kind of before I go through the rationale for each question. Um, I stumble over my words a lot and am horrible at pronouncing things, which is why I do the AI voiceover thingy, so that since it's a lot better at pronouncing things and it doesn't stumble over its words like I do. So just kind of bear with me. I'm not super used to recording my voice like this. So this is something new for both you and me. But hopefully this is helpful. And then, if you guys can't go through a session with me based on your like for the rationale for your um practice test, at least you have a video version that you can refer to. So if you haven't already, because you were listening to me rant, go ahead and answer this first question. So the answer to this first question is going to be C. It's going to block serotonin receptors in the CTZ and vagal afferents. So Zofran, it is considered a 5-HT3 receptor antagonist. Remember, antagonist means it's anti or it's blocking that receptor. It's primarily, see, this is what I'm talking about. Stumble over my words. Blocking the serotonin receptor in the chemoreceptor trigger zone. That's what CTZ stands for. And it's also blocking the vagal afferents in the GI tract. And by blocking those things, it's going to help reduce nausea. Zofran is an antiemetic. So that's the MOA for this med. One of the other things that you're going to have to keep in mind with this med is that QT prolongation. Um, it can cause a deadly heart rhythm called torsades. So monitoring their heart functions, especially if it's given, IV or any of the um, medications that can block like first pass if it's the first time that they've ever taken it, or if they have like anarrhythmia of some sort, just monitoring that heart function. All right, so go ahead, pause the video if you need to answer this question. So the answer to this question is going to be B. It's kind of going to be used as like a reversal agent for this medication as well. But Reglan can cause EPS due to the dopamine blockade in the basal ganglia. So since Benadryl is an anticholinergic, which means it's blocking the PNS, it's going to help restore that dopamine and acetylcholine balance. And so it's going to help with that dystonia that individuals get from Reglan. So the correct answer to this question is going to be dried mouth and blurred vision. One of the most common side effects for any of those blockers of the PNS are going to be dry mouth, blurred vision, and constipation, since it's working on the parasympathetic nervous system. But specifically, cyclopamine, it's an anticholinergic, right? So it's also another thing that you're going to see is urinary retention and confusion, especially if they're elderly. And you might be like, oh, where does the confusion come from? Well, if we have urinary retention and they're elderly, what we commonly see is UTIs. So with UTIs, obviously, those are going to affect the brains of our little elderly patients, and it can make them very confused. So that's where that comes in. So that's something to monitor as well for this medication. Alrighty, so the correct answer to this medication is going to be Ativan. Ativan is not technically an antiemetic. However, it's in the class of benzodiazepine. But what's happening is it's enhancing the GABA activity, and helping reduce that cortical endpoint or input. I'm so sorry. In that vomiting center, it's going to make it really ideal for that anticipatory nausea and anxiety that individuals have when they're going through chemotherapy. It's such a high stress um, situation, as well as just chemo in general, just makes you so, so sick. So um, that's going to help with that anticipatory nausea. A lot of times, too, when they're on chemotherapy, if they're not getting Ativan, we're going to see Zofran on board a lot. So technically, that can be another thing, but since it's another answer, but since it's specifically asking for that anticipatory nausea, so they're kind of anxious and stuff like that. That's why the correct answer is going to be the Ativan. All right, so this one is kind of like that very first question that I had asked you guys. The reason why I do this and I like word questions very similarly to each other, but just kind of make them a wee bit different, is because you might see a question either like that first question or this question on your test. So by wording them both ways, I kind of set you up to maybe see that example on your test. So the correct answer for this one is going to be Zofran. We already talked about that. It blocks serotonin in the CTZ and in the vagal afferents to help reduce nausea. So that is the correct answer for this one. It is B. So this is another one, kind of like question two. We talked about Reglan. Um, but yes, in elderly clients and those who have Parkinson's disease, by having those extra pyramidal symptoms, because it's blocking that dopamine D2, it's going to increase the risk of the extra pyramidal symptoms, or the EPS, which is basically just an involuntary muscle movement. So that's anyone with, like, if they already have dystonia, or Parkinson's or anything like that, those individuals are vulnerable. So we may not want to give this medication to that patient, or if we do, we're going to monitor them because they're already vulnerable, and this is going to increase their EPS. So, dexamethasone, anything with the suffix zone is going to be a steroid. So, you know that steroids are going to be for like inflammation and stuff like that. So, like to help reduce that inflammation through that prostaglandin synthesis, right? So, chemotherapy, it's causing inflammation, right? Um, So we're going to want to try to stop that inflammation. That's why we're going to give the dexamethasone. But the correct answer to this question is a glucocorticoid, so C. The other thing that you're going to need to remember with this dexamethasone, or any of the zones really, is that if an individual is diabetic, um, we're going to have to do extra monitoring on their glucose levels because steroids are going to cause a your liver to kind of um, send out that stored glucose in the body. And then by doing that, it's going to increase an individual's blood glucose level. So if they already have an unstable blood glucose, we're going to have to monitor that. So we already talked about this one and how it works with the PNS. So the correct answer for this one is going to be blurred vision. Remember, if we're blocking the PNS, blurred vision, dry mouth, constipation, all of that is going to be super comic as an anticholinergic. Um, just across the board for all of the anticholinergics, we're going to see those side effects. So we've seen something very similar to this before. The correct answer is going to be B, Ativan. Again, it's going to enhance that GABA activity, which is going to help for that anticipatory nausea that individuals get when they are taking chemotherapy. So the correct answer for this one is going to be the right upper quadrant pain. So that means the patient's right hand side, not your right hand side. Obviously, when we're looking at our patient, our left is their right. So our left hand side, their right hand side is where they're going to be having that pain. Right upper quadrant pain is also going to be associated with gallbladder issues like cholelithiasis or cholecystitis. But it's also going to be seen in any of the other liver disorders like hepatitis and whatnot, hepatomegaly, stuff like that. The other thing to keep in mind is that if you are doing a palpation of that right upper quadrant, what you're not expecting to feel unless it's just the border is the liver. You should only really feel that outside border. You shouldn't feel a significant portion of that liver. And remember, make sure that you're always palpating after you auscultate the abdomen. So we're going to have two questions that are going to be back to back about hepatic encephalopathy. But what I need you guys to know is that hepatic encephalopathy is going to be a decline in brain function due to really any severe liver disease. And what's happening is an individual is having increased levels of ammonia in the blood because they're not able to excrete it. The next question is we're going to go over the rationale on like what you're going to use to excrete um, the ammonia and what specifically is being excreted. But these individuals are going to be confused and sometimes they can be aggressive. But it's because of B, that increased ammonia level in their blood due to the lack of excretion. So for this one, I just kind of talked about that we were going into this. The correct answer is going to be C, lactulose. Listen, I will always tell you guys that lactulose makes you loose if you have liver cirrhosis. Um, and it keeps you from losing your mind, right? So lactulose makes you loose and it keeps you from losing your mind, that confusion and stuff like that. That's what I mean by losing your mind because the increase of the ammonia level. So lactulose is going to help with that. And it's excreting the ammonia through the stool. So that's what's going to help treat that hepatic encephalopathy. But remember that lactulose is a laxative, so they are going to be really, really going to the bathroom. Another thing, if they're diabetic, we're monitoring that sugar level. Anything with OS in it is going to be sugar. And sometimes if they are lactose intolerant, they're going to have an issue with this because it's based on almost kind of like that sugar in milk, that lactose. So just keep that in mind for this medication. So esophageal varices, it's going to go hand in hand with some of the liver disorders. The liver's going to put pressure on the stomach. The stomach's going to put pressure on the um, hiatal area, and then that's going to put pressure on the esophagus, kind of leading to this bulging of the blood vessels in the esophagus. However, what's going to happen is if these rupture, it's going to be a medical emergency. So the correct answer of this is going to be B, because it's not like it's a limb, right? We can't just slap a tourniquet on someone's throat, especially depending on where it is in the esophagus, right? So it's a medical emergency. The correct answer for this one is going to be A. Hepatitis is going to be transmitted through the fecal to oral route. It is an acute infection and it does not have an antiviral treatment available. The other thing I wanted to mention, since we're about halfway through our test questions, we have about 34 of them. Obviously, you don't have to watch all of them, but we have 34 of them. Is that linked in this channel, I have videos going over, the different SNS and PNS receptors. I have videos going over the liver disorders, some of these medications that we see for the GI tract, as well as glaucoma and just everything that might be on your test that's coming up. So keep that in mind that if this rationale is not something that's making sense to you, go ahead and go to the channel and watch those other videos. They go a little bit more in depth than these rationales do. So hopefully, and they're not super long either, guys. Like they're really short. Again, I have ADHD. I mean, like you guys who know me know that I'm not going to make you watch a 20 to 30-minute video when it can be condensed down into 10 to 15 minutes. The only reason why this video is going to be so long is because we're going over so many questions. But again, just if you need the extra help, just go ahead and watch that. So the correct answer to this one is going to be C, body fluids and blood. Hepatitis is transmitted through body fluids and blood, which is why it's so important for healthcare workers to have their hepatitis B because we're constantly exposed to it. The other thing is that with needle exposures and with mother to baby transmission, there are also significant risks for hepatitis B transmission. The correct answer for this one is going to be C, and it is progressive and chronic. Unlike hepatitis A, so the big distinguishing thing between Hep A and Hep C is that Hep A is acute and Hep C is chronic. So with this one, I talked about a little bit at the beginning about that right upper quadrant pain that we're also going to see not just with the liver, but with C for our gallbladder issues, especially if someone has like gallstones, if they're eating fatty foods, they're gonna have pain right after eating that. I like my chicken nuggets and my French fries, but I have gallbladder, so I'm not gonna get like, well, one, I have a gallbladder, and two, I don't have gallstones. So I'm not really going to get nausea and a ton of right upper quadrant pain like those patients will. Um, but the other thing that we're going to see is something called statutorrhea. That means that they have a light colored stool. And I mean, it literally is like pale, like gray clay colored. Not gray, but maybe like a cream clay colored. Like you put your gray clay in the kiln and it comes out that white color. I don't know if you guys know about clay, but it comes out white when you fire it. So that's kind of the color that we're seeing for their stool. But that is a classic sign and symptom of our gallbladder issues. So this patient got their gallbladder removed. So what we're expecting to see is that without the gallbladder, bile is not going to be stored and it's going directly into our small intestines. which is going to lead to diarrhea, especially if they had a high fat meal. So the correct answer for this one is going to be B. So I did say at the beginning that antibiotics, at least I think I said that, I don't remember at this point. But antibiotics are kind of going to be on this because we're going to see antibiotics throughout the GI tract. So we kind of need to understand a little bit about them. For that inflammation of the gallbladder, the cholecystitis, if they are allergic to penicillin, we're going to see cross sensitivity, which means a potential allergy in the class of cephalosporins. So the correct answer for this one is going to be C. Question 20. We have 14 left after this. So for GERD, if we're always taking Tums, we're going to be worried about B, kidney stones, because what's going to happen is that all of that excess calcium is going to build up in our renal system, and that accumulation is going to lead to that kidney stone. For our H2As, we're commonly going to see the suffix betadine for these medications. So again, just medications in the H2As are just they just typically end in dine. So if you see that, or some of them end in just DINE, if you see that, think of your H2As. So PPIs, they're going to help alkalize our stomach for our GERD and our PUD patients, right? So by alkalizing that, we're going to be at higher risk of infections, especially if we're taking antibiotics like a broad spectrum antibiotic. So the disorder that we're most going to be worried about, or the infection, sorry, that we're most going to be worried about with the PPIs, in this case, is going to be C. diff. So answer choice B. Since it's alkalizing that stomach acid, bacteria like C. diff are going to overgrow and then increase that risk for risk of C. diff infection. So, this is kind of going in with that last question. We have an overgrowth of the H. pylori. We did that breath test that we're going to talk about in a minute and how that works, what we're expecting to see to get a positive result. But if a patient does have the H. pylori infections, obviously, since they have PUD, we're going to do the H2As, we're going to do the PPIs, and we're going to do antibiotics. But again, just like the previous question, if they're on a broad spectrum antibiotic and they're taking that PPI, making their stomach more alkaline, you're going to have to monitor for those watery, foul smelling, very urgent stools that are common with C. diff. Oh, sorry. The correct answer choice for this one is going to be C. All right, question 24. For H. pylori, the correct answer choice is going to be C. If H. pylori is present, we're expecting a metabolism of the sucrose by the bacteria. So there's sucrose in the solution that the patient is going to drink. And once the bacteria metabolizes it, it's going to produce urea as a byproduct, which is then blowed out during the breath test. And that is how we get a positive H. pylori test. So I know that you guys haven't fully gone into antibiotics yet, and you're gonna have a full microbes lecture and all of that, but I did just want to make you aware in the event that you did see a full antibiotic test on question about what a important caution for at least one of these other antibiotics was. So the answer to this question is going to be B, the increased risk of photosensitivity. So tetracyclines are going to cause permanent teeth staining. They're also teratogenic, which means that they're harmful to a fetus. and it's going to increase the sensitivity to sunlight. So make sure that you're telling your patients to put on their sunscreen. So the correct answer choice for this one is going to be C. Bulk-forming laxatives like psyllium or Metamucil are fiber-based, and they're going to help absorb water in that GI tract, which is going to add some bulk to that stool, and then it's going to stimulate that ganglion cells in the stool, ganglion cells in the GI tract to help stimulate a bowel movement. So, one thing that is a huge pet peeve of mine is multiple times when giving Imodium, I have heard people say it doesn't make any sense why we dispose of Imodium in the cactus bin. We are going to dispose of Imodium in the cactus bin because of A. Imodium uses the same exact receptors as opiates. Yes, your regular morphine, fentanyl, all of that. It uses the same receptors. So because of that, we have to dispose of it like it is an opiate. Because if someone is consistently on like Imodium, like they've been on it for a really, really long time, it can lead to euphoria and it needs to um, have like careful monitoring because of the fact of the risk of substance abuse since it's using those um, substance use, sorry, because of the opioid receptors. So the correct answer to this one is going to be B. When you see skip lesions, basically this is going to mean that since Crohn's disease can happen anywhere in the GI tract, not just the colon like you see, skip lesions mean there may be a lesion in the duodenum, there may be a lesion in the ileum, there may be a lesion in the transverse colon. Those are what we mean by skip lesions. It's an area where it's lesioned versus an area where it's not lesioned, lesioned, not lesioned. It's kind of like a little pattern versus UC is going to start at the rectum and go up the colon, and it doesn't skip. It's just going to go straight from the from the rectum and then up the sigmoid and descending and so on and so forth. But that's the largest difference between Crohn and UC. The other difference between the two is that UC is going to have bloody stools, while Crohn's disease is normally going to have non-bloody stools. So, if you see methotrexate, please, 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 please give your patient folic acid. It is going to prevent that bone marrow suppression. It is so important for these patients to take folic acid. Just as important as it is to counsel these patients to make sure that they're monitoring for any signs and symptoms of bleeding and making sure that they're using a soft toothbrush because of that bone marrow suppression. That is a common adverse effect for the methotrexate. All right, the correct answer for this one is going to be D. The reason why we see dark tarry stools or melena is the medical term for that. That's going to mean that the bleeding is higher in the GI tract because it's going to be kind of sitting there and having to go through everything. And that's why we know it's a GI bleed because it's had time to almost like oxidize in the GI tract and become darker. Versus if it was lower, it would be way more red. Alrighty, so parasympathetic and sympathetic nervous systems and their neurotransmitters. I have 3 videos on the ANS, one that's just ANS by itself, and then 2 that are breaking down the different receptors of each nervous system in ANS. So for the answer to this question, we're going to see D as the correct answer, acetylcholine. It is a primary neurotransmitter for the parasympathetic nervous system, and it is primarily responsible for that rest and digest. Alrighty, so for this question, the answer is going to be C, inhibition of digestion. So when we activate our SNS, it prepares our body for fight or flight, which is going to include inhibiting digestion because it's going to divert energy resources to our heart rate, to our lungs for dilation and our pupils for dilation and all of that stuff. So that's why there's going to be inhibition of digestion. There's going to be a decrease in saliva, and there is going to be inhibition of our urinary system. Glaucoma. I have a whole video on it for you guys, so make sure you watch that. But the correct answer for this one is going to be B, the gradual loss of peripheral vision without pain. Key word for open angle glaucoma versus closed angle. That's our medical emergency. That is painful. Open angle glaucoma has a slow and painless onset that's often going to lead to gradual loss of peripheral vision, and we're not going to notice symptoms normally until significant vision loss or tunnel vision occurs. Very commonly seen in our diabetic patients because of that increase in ocular pressure. And that's just what glaucoma is an increase in ocular pressure to begin with. That's putting damage on our our optic nerve. But you can learn more about that in my glaucoma video. All right. Here's our one vitamin question. It's going to be the most important vitamin question. I know you're a little confused because that says warfarin on it. Um, and the correct answer for this is going to be vitamin K. So answer choice C. Vitamin K is essential for clotting factors. This is why we give to babies when they're first born because their liver can't clot. So when individuals are on warfarin, they need to maintain a consistent vitamin K intake to avoid a bleeding risk. And if they do have bleeding and they end up in the hospital with it, vitamin K is actually going to be the reversal for warfarin. All right, well, that is everything I have for you guys. Again, thank you so much. If you have any questions, feel free to reach out, comment, like, and subscribe. And I will see you guys in the next one. Bye-bye.